So how many injections per week should you be doing on your TRT protocol? At Men's Medical Clinic in Leeds and UK, we tend to do a minimum of twice per week TRT injections. So for example, we might do 50 milligram of testosterone cypionate twice per week. Now I find with most men, twice a week is a minimum in terms of frequency. Now, if you're doing large boluses once a week or once every 2 weeks, what you tend to find is you get a massive supraphysiological peak in terms of the testosterone, and then you're outside of the therapeutic range in the second week. With the massive physiological peak, you tend to get higher hematocrits, you tend to get more aromatization, and generally more side effects. So often the patient may feel jittery, anxious, flushed, and then towards the end of the 2 weeks, they might feel tired again. They might have the low libido and fatigue again. So with twice a week, we're trying to build some stability in the blood of the testosterone and avoid huge peaks and troughs. Now, daily microdosing works for some patients, but I do find the more you increase the frequency, there is an element of diminishing returns. So for most patients doing microdosing or daily injections, they're not going to get a significant benefit compared to doing it 2 or 3 times a week. But they may have better compliance and it might be more convenient for them just to inject twice per week. So generally twice a week is the minimum, but some patients we do microdosing, some patients we do 3 times a week. It just depends on the patient, but for the vast majority of patients, you should be aiming for twice a week in terms of frequency of injection.